If you think you have fatty liver disease, then you are not alone. Recent studies have estimated that 1 in 3 of us have it, so why is it so worrying? Well, fatty liver disease is on the rise and is one of the main reasons why people get scarring in their liver, a condition known as cirrhosis. This kind of scarring is the most common reason why people need a liver transplant. If you're new to the channel, my name is Khalid. I'm a family doctor in the UK, and I've seen this upward spike in cases over the last few years. And the really tricky part is it's not always easy to know when you've got it. In this video, I'm going to deep dive into the important signs and symptoms to look out for. I'll be breaking them down so you know exactly what the early signs are, why they happen, and some real worrying red flag symptoms of late stage fatty liver disease. Which, spoiler alert, if you have, you probably need to see a healthcare professional urgently. Now, it's vital that we know what the problem is before we jump into how to detect it. So what is fatty liver disease? Well, the more accurate name for it is non-alcoholic fatty liver disease, and it's pretty much what it says on the tin. As we put on weight and have extra fat around our body, it starts to accumulate around our organs, and in this case, the liver. There are 4 stages that we'll quickly go through. The very first one is something called simple or early fatty liver. This is usually a buildup of fat in the liver cells, which may only be diagnosed on a blood test called liver function tests. I'll link a video up here in case you want to know a bit more about these tests. Now, stage 2 is non-alcoholic Steato hepatitis, aka NASH, a more serious form of fatty liver disease where the liver has become a bit more inflamed. Stage 3 is called fibrosis, where there's ongoing inflammation, which is called scarring of the liver and nearby blood vessels. But the liver is still able to function normally so far. And that brings us on to the final stage, which is cirrhosis. This is the most severe stage, and this happens after years of inflammation and scarring where the liver starts to shrink, it becomes really scarred and lumpy. And in this final stage, the damage is permanent and it can lead to liver failure where your liver stops to work properly. Sometimes it can also increase your risk of getting liver cancer. So in terms of timeline, it can take years for the 2 more worrying stages, so fibrosis and cirrhosis, to develop. And obviously, the earlier you detect you have fatty liver, the easier it is for you to try and do something about it and to stop the progression to those more worrying stages. As always in healthcare, the tricky part is finding the problem before it really causes a major issue. Now, fatty liver disease is notoriously difficult to pick up before it starts damaging the liver, and so it's super important to keep an eye out for these early signs and symptoms. The first and most common way we pick it up as doctors is actually through a blood test. Now, you may have had a routine blood test just to have a general health checkup, and you found that your liver function tests are up. And this could be a raised ALT or raised AST. So last week's video was about ALT, and I'll do another one about liver bloods. So make sure you drop a subscribe if you want to catch that. Now, the reason people get abnormal liver tests is the fat around the liver starts to affect how the liver works. If people have persistently high levels of liver function tests, I would often send them off for an ultrasound scan. It's basically the scan that pregnant women get. In your case, it'll be looking at the liver. So when we get an image of what the liver looks like, you can start to see roughness in it, scarring, and also picking up fat around the liver. Now, in terms of symptoms, some people with fatty liver disease may have generalized symptoms like fatigue, weakness, feeling tired all the time. We don't really know exactly why this happens, but we know that your liver regulates much of your storage, your release, and your production of energy for your body. And so when we deposit fat in those areas where it shouldn't really be there, perhaps that starts to affect how efficiently the liver can do its job. Like a couple of months ago, I saw a 45-year-old chap in my clinic, fit and well, no sort of medical issues, but he was complaining of a vague discomfort in the right side of his tummy, so just under the ribs. This brings me on to the next symptom, which is discomfort, ache, or fullness in the right side of your abdomen, just under your ribs. With him, we sent him for a blood test and an ultrasound, and that's how we found out he had fatty liver. In terms of why people get these symptoms, it may be that as the fat deposits around the liver, it may cause the liver to enlarge, and as it grows bigger, it starts to cause a dull ache as it presses against other structures in that area. And sometimes if the liver is large enough, we can also notice the edge when we examine your abdomen. But important to know that not everybody with fatty liver disease will get discomfort, pain, or enlargement of their liver. And the caveat is there are lots of things that can give you pain in this region, things like gallstones. So if you're getting this, best to get it seen to by a doctor and investigated. Okay, on to the final early symptom to look for, and that is unexplained weight loss. Generally speaking, as a doctor, unexplained weight loss is always a worrying symptom for me. So you might be thinking, well, why would you get that if fatty liver disease is mostly linked with being overweight or obese? And that's a good question. In fact, I had to look it up just to be sure, but yes, fatty liver disease is linked with obesity, metabolic syndrome. It is thought that as you get a progression through the stages, the different stages we went through, some people may experience weight loss, and this could be down to the inflammatory process that's going on in the liver. All these inflammatory molecules will be whizzing around your bloodstream, and sometimes you're not able to fully break down toxins as well. And so you get a buildup of inflammatory molecules, toxins, which can give you sometimes a bit of a nausea. And as you know, if you're not feeling quite right, you've got a bit of nausea, you feel a bit sicky, you're probably not going to be eating as much as usual. And that's only one part of it. The second part is as the liver is working harder and trying to cope with this extra stress and pressure, this increases the resting energy consumption of the liver, so how much energy it takes in when it's doing not much at all. And in real terms, what that means is you're burning off more calories at rest. So these two mechanisms together could be a reason why some people may lose weight, but we still don't know for sure. Not everyone will have weight loss, and always, I say this, that a sign of unexplained weight loss in any patient needs more investigating because we need to know exactly what's causing it. Now, onto some of the later stages to look out for. These will often occur if the liver is struggling to cope or has had years of inflammation or scarring. I've done a video that shows an example of all of the skin signs to look out for, and you can tap up here to watch that. I'll also link it at the end if you want to watch it at the end. The very first one is itchy skin. What I mean by that is if you have an itch with no obvious rash, then it's worth getting your liver checked. The itch that people get with severe liver disease is thought to be down to a number of factors. Number one is buildup of something called bile salts. These are products that would usually help you in your digestion, and as it builds up in higher levels, this causes irritation. Also, your liver helps process and break things down, and as it gets more inflamed, it can't do that job as well. So the ability to filter your body's toxins becomes less effective. So those toxins are going to be swimming around in your bloodstream, and in turn this can irritate parts of your body like your skin. Now, some people may also notice a buildup of fluid in their legs or feet. This is called edema, and if this fluid is in your abdomen, this is called ascites. While lots of things can cause this buildup of fluid, things like heart failure or heart disease, kidney problems, it can also be seen in liver cirrhosis or late-stage liver disease. So why does this happen? Well, firstly, people at this more advanced stage of liver disease develop high blood pressure in the blood vessels leading into your liver. Think of it this way, as your liver becomes more scarred and damaged and tougher, the blood flowing through it can't do it smoothly. It basically faces a lot of resistance. That extra resistance causes more congestion and backlog. Think of it more like a traffic jam going into your liver. Over time, the pressure goes up in that area, trying to push everything through quicker. And the problem with that extra pressure is that further downstream, so past your liver in the blood vessels, what happens is more fluid is being pushed out of the walls of the blood vessels. So when the fluid is pushed out of the blood vessels, it starts to accumulate in your abdomen, and this can be called ascites. Now, the second mechanism is down to a protein called albumin. Albumin is an important protein in our bloodstream that acts almost like an anchor for a ship. In this case, the ship being all the fluid in your blood vessels. Albumin keeps all that fluid inside your blood vessels. Now, the problem being albumin is made by the liver, so if your liver's not working properly, you get less albumin. Less of that anchoring protein means fluid can easily disperse through your blood vessel and start to roam in areas that you shouldn't really have fluid. And over time, due to gravity, this fluid can sift down the body and into your legs, ankles, feet. Okay, on to the next sign, and it's probably the obvious one that everybody thinks about with liver problems. It's called jaundice, and it's when you get a yellow tinge to your skin or that yellow look under your eyes. The reason you might get this is related to something called bilirubin. Billy, what, you might ask? Well, when old blood vessels are broken down, a product called bilirubin is left behind. Normally, when your liver is in tip-top shape, it processes bilirubin, no sweat. But if it's damaged and not able to do this, the version of bilirubin that builds up in the body, as you may have guessed it, has a slight yellow tinge to it. So jaundice occurs because you get a buildup of bilirubin because your liver's not able to process things properly. If you notice you have a loss in your sex drive known as your libido, then this can sometimes be linked with liver disease. You see, the liver processes lots of our hormones, and there can be an imbalance in fatty liver disease, which in turn affects our sex drive. Likewise, the liver plays a key role in producing our clotting factors. These are things that help our blood clot properly. So in liver disease, you tend to see people who suffer from more unexplained bruising, or when they bleed, it can take abnormally longer for their blood to clot. If you notice that your urine is a darker color, then this can also be a sign. Like we mentioned earlier, bilirubin building in the body can give us a yellow tinge. Well, when it's taken out of the body through the urine, it can make the urine look darker. At times, the urine can also be foamy. Now, since we're on to things that our body kicks out, we can talk about poos. The usual brown color that is in our poo comes from bile salts. When we have liver problems, we can get a distinct paler looking poo. The poo can also be a little bit oily or greasy, and that's because we're not producing the right products to break fat down. So that fat is being kicked out of your body in your poo. And so this brings me on to the most important red flag symptom, the thing you should never ever ignore. If you get tarry black poos, this is known as Malena. It can often mean that a person has had a bleed in their upper digestive tract. I'll give you my own personal insight into how scary this can be. So we were on holiday a few years ago visiting family in Sweden, and my dad, who's usually a great hiker, great at trekking and things like that, was finding it a bit more difficult to catch his breath, to keep up with everybody. Later on, when we got home, we checked his blood pressure. It was a little bit low. He kind of complained of having maybe a bit of a stomach bug and a bit of diarrhea. We thought maybe he's dehydrated, let him sleep it off, rest. Now, eventually that evening, we took him to the emergency department because he didn't look right, and his blood count was all the way down to 70, meaning that he was bleeding internally. Eventually, he had a camera test which showed that he had a bleeding ulcer. He's always had like acid reflux and probably had a stomach ulcer for many years. Now, thankfully, he's doing much better and on the right medications, but later on, talking to him, he did say he had dark, tarry poos, and he thought it was probably a stomach bug. Make sure if you've got that kind of dark poo, never leave it unchecked. Go see a doctor immediately. This is called Malena, and it also has a distinct, really strong smell to it. And in context of liver disease, we talked about that congestion in the blood vessels. Well, they can get blood vessel engorgement around their gullet. This is called esophageal varices, and these can bleed on their own. And if these burst, the blood that goes through your digestive tract gets digested and the color becomes dark or black. Sometimes people may get it coming out the other way, so if you're vomiting blood, that again can be a very worrying sign. Now, if we're not taking my dad to hospital that evening, who knows what would have happened. So tarry black poos, vomiting up blood should never be ignored. Not everybody with fatty liver disease will ever reach the stages we've talked about today, but knowledge is power. For most people, they may stay in those early stages where they have little to no symptoms at all, apart from maybe a rise in their liver blood tests. But who knows, maybe somebody's watching this right now and notices one of their symptoms, and this may be the push that gets you to get it checked out. If that's you, please let me know in the comments, because the liver is an incredible regenerative organ. It's almost like Wolverine from X-Men. And I've seen some really fantastic results with some of my patients who've managed to reverse their fatty liver with simple lifestyle changes. Click on this next video if you found this useful and you want to learn more.